Welcome to ecert training. Now in this video, we're discussing a vital topic in maintaining health and safety in care settings. It's all about the best practices for hand hygiene. Now, proper hand hygiene is crucial for preventing the spread of infections and protecting both residents and staff. In this video, we'll cover key points on how to ensure effective hand hygiene in care homes. Let's get started. First and foremost, understanding the importance of hand hygiene is essential. Hand hygiene is the most effective way to prevent the transmission of infections in care settings. By thoroughly washing hands at critical times, such as before and after resident contact or handling food, we can significantly reduce the risk of infection. Next, mastering the proper hand washing technique is crucial. Begin by wetting your hands with clean running water, then apply soap and lather well. Rub your hands together for at least 20 seconds, ensuring you clean all surfaces, including the backs of your hands, between your fingers, and under your nails. Rinse thoroughly and dry with a clean towel or an air dryer. In addition to hand washing, using hand sanitizer is an effective alternative when soap and water are not available. Ensure that hand sanitizer contains at least 60% alcohol. Apply enough product to cover all surfaces of your hands and rub them together until dry. Hand sanitizer is particularly useful when moving between different areas of the care home or when handling medical equipment. Knowing when to perform hand hygiene is equally important. Key moments include before and after direct contact with residents, after using the restroom, before eating or handling food, and after touching potentially contaminated surfaces. Regular hand hygiene breaks should be incorporated into the daily routine to ensure consistent practices. Ongoing education and training are vital for maintaining high hand hygiene standards. Regular training sessions should cover proper techniques, the importance of hand hygiene, and updates on best practices. Providing staff with continuous learning opportunities helps reinforce the importance of hand hygiene and keeps everyone informed about the latest guidelines. Implementing a monitoring and compliance system ensures that hand hygiene practices are being followed correctly. Regular audits and feedback sessions can help identify areas for improvement and reinforce good practices. Encouraging a culture of accountability and transparency will lead to better adherence to hand hygiene protocols. By following these hand hygiene best practices, you can significantly enhance the health and safety of your care home environment. For more tips and training resources, be sure to visit our website. And don't forget to like, subscribe, and hit that notification bell for more updates. Thank you for watching and stay safe.